So today's topic is the pathophysiology of the type 1 diabetes mellitus and type 2 diabetes mellitus. First, type 1. Genetic predisposition and environmental trigger. Genetic predisposition means it is responsible by the genetic factor, or it varies from one generation to other generation. Next, environmental factors like virus, toxin, immune system attack the beta cell of the islets of Langerhans. It is an autoimmune disorder. Our immune systems attacks the beta cell which is present in the pancreas of islets of Langerhans. Beta cell secretes the insulin. So progressively beta cell destruction occurs and no insulin production. Here the glucose cannot enter the cells easily. This is called the hyperglycemia, and the cells use fat for energy. This is called lipolysis. When the glucose doesn't enter the cell, then for energy utilization the fat breaks down. This is called the lipolysis, and the breakdown of the fat, and it leads to the ketone body formation. This is called the diabetic ketoacidosis. Okay. Next, type 2 diabetes mellitus, pathophysiology of type 2, obesity, sedentary lifestyle, genetics. Body cells, muscle, fat, liver become resistant to insulin. Pancreas is initially compensated by increase the insulin secretion. Beta cell dysfunction and decrease the insulin production. Here the obesity, this is related the daily lifestyle basis also. Even a person is fatty or suffers from obesity. Next, a person who leads a life as a sedentary lifestyle, even also the genetic problem, then the body cells become resistant to insulin. Here the insulin deficiency occurs. The pancreatic beta cell does not produce the enough insulin. Okay, so by its compensation, the insulin secretion is increased, but then it occurs the beta cell dysfunction occurs and insulin production decrease. Same as the type 1, glucose cannot enter the cells effectively. This is called hyperglycemia. When the blood glucose level is increases in our blood, and the liver also increases the blood glucose level. Liver also increase. In the liver, the glucose production also increase. This is called gluconeogenesis, and no ketone body formation here is present, and it leads to the hyperosmolar hyperglycemic state. The nursing diagnosis of the type 1 and type 2 diabetes mellitus means diabetes mellitus. Okay. Imbalanced nutrition status. Imbalanced nutritional status, more or less than body requirement related to the insulin deficiency, and improper diet as evidenced by weight changes. And next, risk for unstable blood glucose level related to inconsistent insulin use or stress. Impaired urinary elimination related to osmotic diuresis as evidenced by polyuria. Fatigue related to the decrease of the glucose utilization evidenced by weakness, less active or decreased activity level. Impaired physical mobility related to neuropathy is evidenced by observation. Risk for infection related to hyperglycemia. Risk for impaired skin integrity related to poor blood circulation evidenced by slow wound healing. For your kind information, diabetes type 1 or type 2. Type 2 diabetes mellitus is the metabolic disorder. Okay. So diabetes mellitus is the metabolic disorder. It is characterized by the hyperglycemia, or the blood glucose level. When the blood glucose level is increased, glucose level is increased in our blood. So this is called the hyperglycemia, and the normal level of the range of the blood glucose level in our blood is 70 to 140 mg per dl.